So as I began surgery, it's a long time ago. Incision was long, stem was long, and the length of stay was 15 days. Now the incisions are short, the stems are short, and the length of stay is short, and life is also what I think it's just evolution, like Santa Claus you see here. That's the new one. So what we do since 2014, we make a fast-track program, very classical program, and our goals was the patient have to leave the hospital after 2 days. We want to reduce complication if possible, and we want no selection in patients. We use a short stem, optimys, arm cups, 28 or 32 millimeter heads. And only contraindication for short stem was severe osteoporosis. So who was involved? You see, it's a team, but the very important piece is the patient. He must feel safe and confident on the process. And all these people have a role. The surgeon has a little bit low role in this technique, but he must be there to motivate all the other team. The rules were simple. We make a pre- and post-operative education of the patient with a collective meeting, nurses and physiotherapists education. The goals are given pre-operatively to the patient. We use blood-sparing techniques, no drainage, tranexamic acid, infusion, and local. We use LIA with ropivacaine, unilateral spinal anesthesia if possible. And the first raise must go on before the 4th hour after operation. And use systematically a bladder scan to depict some problem with the bladder. We have to obtain patient acceptance. That's very important. He must feel safe all over the process. We have a discharge checklist, a phone call, and a 24-hour phone number with a trained nurse at the end. The patient worked with 2 crunches, 3 weeks, and he had no physiotherapy, never. So first, do it better, and then do it faster. And you will see we had some problems when we want to go too fast. That's a patient about 2 hours after operation with a short stem. And the advantage of this tourist is he feels very safe. And so he's confident. "448 short stems and 405 cemented carpal stems. We use every time Watson-Jones approach in supine position, and we made 30 bilateral in one stage. 210 women, 238 men, that's a normal theory. Average age 65 years versus 69 years. You see the oldest one was 94. Pre-operative hardship score 33. And we do 88% of spinal anesthesia. So the first goal was obtained. The average length of stay, 3.3 days. So it's possible. Minimum 2 days, maximum 7 days. All patient came the day before operation due to financial aspects in France. So we have to make him come in the day before the operation. Bilateral hips stays in the hospital 4 days every time. Since this year, we all go down to 3 days. And 85% of the patient leave the hospital before the second day. And the hardship score was absolutely normal. You see, 87% of the patients go home, and 30% go to an aftercare unit. It's better than with the cemented stem. It's probably due to the age of the patient. But you see, in 2013, before the fast-track program, about 50% of the patients go to an aftercare unit. Complication, 0.7% infection, 0.7% fracture, no with the cemented stems, but it's not significant. 0.7% dislocation versus 0 with cemented stems. That was due to too much optimys. We gave any consent to the patient. He can walk, can make what he wants. That was the step too wide. 0.8% blood transfusion versus 3% with cemented stems. That's significant. And the medical complication has quasi disappeared. In conclusion, we reinstate prevention instructions for dislocation, and since then we have no problem. We have a very low transfusion rate compared to cemented stems. It's a safe procedure. You can do it with short stems without any problem. Hormones were more common, also with short stems. That's at the end the conclusion of our symposium. That was 1 week ago. 2,000 patients, and fast track should be the standard procedure of OTHA or TKA. There is no posture magic. I think the only thing you have to do is to think about that and to optimize your procedures. And you have concluded you have 11 centers that participate, and nobody does the same. Always goes to Rome. Thank you.